Welcome to the Leverage Factor, where legacy meets purpose, partners with power. I am your host, Bishop Charley Hames Jr., and today I have a very special guest that I know very well. I'm just going to read a little bit to you just to share who she is. Michelle Gaskill Hames serves as the president of Kaiser Permanente, Southern California and Hawaii markets, overseeing one of the most complex and compassionate health systems in the country. She is not just a healthcare executive, she is a force for good, a strategic reformer, and yes, the love of my life. From transforming care delivery to mentoring women of color, Michelle embodies what it means to lead with head, heart, and holy purpose. Let's get into it. Let's welcome Michelle Gaskill Hames. Hey!
Hey, babe. How you doing?
I'm good. How are you?
I'm good.
Good. We're going to dive right in.
Let's do it.
We're going to talk about conversations and questions. You said before that leadership is both privilege and pressure. How has your personal journey shaped the leader you are today?
First of all, I love that question. It's definitely a privilege and an honor to have a chance to have the opportunity to change the lives and improve the health of 5 million members. And I do not take that lightly. And I take the responsibility very seriously. You asked how my life has been informed, how my
personal journey.
So I'm going to give you the short version of that story. There's a very longer version, but the short version really is centered around my father. And you know this, and I've talked to many others about this, so people may know, but I was blessed to be raised in a household with a father who was in a tragic car accident when he was young and was paralyzed as a quadriplegic with very limited movement of his lower body and his upper body. And I say I was blessed by this because I was able to see this man determined to overcome every obstacle and to be able to achieve that. And that instilled in me this drive and perseverance. But what it did from a healthcare standpoint is, for those that know about quadriplegia or paraplegic individuals that don't have the ability to move their lower body, upper body, they're often prone to all kinds of health ailments, whether that's pressure sores, whether it's pneumonia. So my father was in and out of the hospital as I was young and as I was growing up. And I saw the healthcare industry. I saw nurses and physicians as heroes, as healthcare heroes, because my father would go in, they would take care of him, they would restore him to optimize his health. And I wanted to be a part of that. So early on, that's what influenced my journey in healthcare. But what influences it now was toward the latter part of my father's life. My father has passed. But in that time period, when he was ill right before he passed, I saw the healthcare system fail. And I saw physicians, nurses, caregivers, and others not putting our family in the center and not recognizing that my mom and I and others who had been on this journey as caregivers for so long really had a perspective and had a voice. And so that inspired me to say, you know, at the time of my father's passing, I was the COO of a health system. And I saw that we don't always get it right. We absolutely lean in and we try to, but we've got to put the patient in the center. And so my father's journey has inspired me to get into healthcare, and it's the fire that continues to keep me committed to the healthcare industry, because we save lives every day, and we're so proud and grateful to have the opportunity to do that. But we want to get it right every time for every patient, and that's going to involve listening to them and involving them in the care plans.
So let me shift the conversation back to something that you said earlier about serving 5 million members. What internal mindset shift most prepared you for that kind of task?
Was blessed to start at the bedside as a registered nurse. And so, you know, I had the privilege of taking care of one patient at a time or one critically ill newborn at a time. And that same perspective that I had with the patient in the center as a caregiver is what has prepared me, no matter what scale or size of membership that we have that I'm responsible for, we got to put the patient in the center. And so that's the mindset that I bring to it. And that's why I'm so excited about where healthcare is now, because it's becoming much more individualized, and we're able to understand through AI and digital technology each individual patient and what their unique needs are. And, it's our responsibility to try to meet them where they are.
So as a Black Latino woman, because most people don't know that you're Black and Latino, as an executive in healthcare, what are some of the unspoken battles you face, and how have you leveraged those moments into wisdom?
Yeah, it's a great question. I have found myself at many points in my career being the only, being the only young person early on, being the only minority or a Black Latina in the room, sitting in boardrooms with folks that didn't look like me. And at first I found that a challenge. I thought, okay, how do I find my voice when I have a different perspective? Then I was able to learn how to flip that on its head because I had a different perspective, because I came to the table with a unique viewpoint. It was, one, my responsibility to get it out there and to have it heard. And two, I recognized that when I spoke, because I was saying something unique and different, it was going to be remembered. And so I started using what I thought was a difficulty to be my greatest strength. And I knew that when I spoke, it would be heard. So I made sure that when I spoke, it had purpose. And so that's been kind of my way of navigating through being the only. And now I'm grateful that I'm not the only. We're still not where we need to be. We still need to have more, in healthcare in particular, more leaders that look like the communities that we serve. So again, we can be individualized to those unique needs, and we can address health disparities that exist in certain communities. But I'm glad to see that we've opened doors and we're bringing others along, and that's my responsibility to continue to build that legacy of other leaders that look like the communities we serve.
So Kaiser Permanente is both mission-driven and data-intensive. So how do you lead at the intersection of innovation and compassion? Because most people can only do either or, not both and.
Yeah, I love that. It's one of the reasons I'm so proud to be at Kaiser Permanente. Because we are the health plan, we are the hospitals, we are the medical group, we are the comprehensive care. It allows us to have information about our patients that we not only address what's ailing them when they come to a hospital, we don't address just the sickness. We're actually able to get into preventative care. We're actually able to understand with all the data. And I get back to individualized data for every member. We can use that to lean in and be predictive about what experiences the patient, what health issues the patient may have in the future, and lean in and prevent that. And so that's an example of using data, being innovative, but using it to meet patients and to be able to create an experience that meets them where they are and it improves their overall health.
So what kind of system level strategy are you most proud of initiating that has produced a lasting change for patient and staff? I've known you for a long time, and I've known you being the initiator or pioneer in system change. Just share a couple of examples.
Yeah, I'll share something I'm really proud of that I will not take any credit for. It's our teams have been doing this before I came to KP, and we've been perfecting it. But we, I've mentioned our viewpoint is not just dealing with patients, the physical health. We will take care of them, and we have the best tertiary and quaternary care that you can have, and cardiac, all of the most complex disease states. We have the experts. But I am really proud about how we lean in on the front end and we help patients where they are, not just with their physical health, certainly with their mental health. But I'm really proud of what we've developed, which is called a social risk score. As patients come into us and our physicians are interviewing and talking to our patients, we understand the social determinants of health that may be gaps in their lives. For example, there may be patients that have home insecurity, food insecurity, or are not socially connected. These are things that are going to impact their health. And so our physicians, our nurses are able to make that assessment and create a score to understand, okay, these are the areas that are at risk for this patient. So I need to make sure as a provider that I need to follow up with them more regularly. I need to get them connected into resources that are going to address not just the physical health, but these other social needs that they have that will impact their physical health. And so KP has been a pioneer in this, and I'm excited to watch as we're perfecting that and really seeing the impact on our members.
And let me just interject this for our viewers. Home insecurity may not be that they are unhoused residents. may be that they don't have stable housing, that they're moving from house to house. So it's hard to keep up with charts. It's hard to keep up with, making sure medications arrive on time at home. Food insecurity could not just be the fact that they don't have enough nutrients, but they might live in a food desert where most of the food that they get access to come from fast food versus fresh fruits and vegetables. So a lot of things can kind of go into social determinants. I just want to unpack that for you all as we move to our next question.
Can I piggyback on that? That's such a great point, babe. On the home insecurity, exactly right. Certainly KP gives grants and we're participating in projects to fund housing. But what we do that I'm really proud of is that we have a program where we bring legal advocacy into our medical facilities. For example, in the emergency department, we have a legal advocacy team at people call it Sunset, LAMC. We have a relationship there where as we find patients. We got a great story of a woman that came in diagnosed with breast cancer and had challenges. She was going to be evicted from her home. Because of the partnership that we have with the legal aid team, we were able to bring an attorney to come work with her and advocate for her to be able to successfully keep her home, because they found that there were some, the things that the landlord was bringing forward to evict her were not lawful. And so it's things like that when we look at total health.
That's crazy. That's amazing.
And we look at partnerships because Kaiser Permanente doesn't desire to be all. So we partner with a lot of agencies and a lot of social organizations that can help support our members, again, not just physically, but total health.
Yeah, so it's much more than just an insurance plan. It's literally thriving for the whole person.
Right. More than an insurance plan, more than the hospitals, and more than the medical group. It is all about, it's total health.
Hey, people been seeing me online for years working out, and yes, that's the way we live. But many people say, well, what do you wear when you work out? Well, I wear swag from drcharleyhames.com. This shirt literally says, rep with purpose, lead with faith. You can get this on drcharleyhames.com. Also, I have the Leverage Leadership workout gear, and we also have hoodies as well. And if you just want a good cup of Joe, you can have it with your Leverage Leadership cup at your convenience. I'm telling you, you need to get this stuff right now, drcharleyhames.com, because it's good until the last drop. Awesome, awesome, awesome. Listen, healthcare is often about the body, but you've spoken powerfully about the soul of leadership. What spiritual or grounding practices help you lead with clarity? This is your time to testify.
Well, I'm grounded in my faith, clearly. And I think at this point in time, it's so important to be grounded and to have an outlet. There's so much, you can throw yourself into work and you can continue to burn the midnight oil. But if you're not replenishing your spirit, that's going to get tired. And so I find, first of all, prayer. Second of all, time with family, time with friends, time to play, right? Work hard, but play hard. Find time to go on vacation and, just enjoy, whether that's traveling, whether it's fine dining, many of our habits that we do together. I think it's important to carve out that space. And the most successful leaders understand that, right? I think the old school leadership style was get into work early, you leave late, you work through the weekends, and you just keep going. The new school leadership understands that's not sustainable. You got to take care of yourself.
So if you could write the next chapter of healthcare in one sentence, what would you say?
In one sentence?
One sentence.
So I'm going to sound like a broken record, but it's about precision medicine. It's about individualized care. It's about the patient in the center of all that we're doing. And digital technology and AI are enabling us to take that to a whole different level.
All right, is that a run-on or is that a regular sentence?
That was one sentence.
Okay, I'm just checking. All right. And finally, what is your personal leverage factor? The truth or trait that has most helped shift your influence into impact. So what is your personal leverage factor?
Authenticity all day long.
Yes. Talk a little bit more about it.
So, I think for a long time, many folks thought you had to show up at work and be a certain way, look a certain way, bring certain points up that, seemed like they were the right things to say. What I've found, like my personal superpower, if you will, and it's a superpower that I see in the team that I'm building, is that we show up 100% every day ourselves. And when you can be your authentic self and you can bring your unique perspective, as different as it may be, it brings all the perspectives to the table so we can make sure we're not missing anything. And we have the best solutions when we show up 100% ourselves.
That's amazing.
And I would go further. Authenticity is the best way to bridge relationships. And leadership now is all about being able to relate and build connections with partners, with patients, with colleagues, with peers, with those that report to you. Is so relational because there's so much change happening at such a rapid clip. And if you have relationships and you build connections, we can navigate through that change better together.
All right, sounds good. Here we are. Are you ready? This is rapid fire round.
Okay.
So whatever the first thing comes to mind, that's what I want you to, don't think about it, just go. A leader who inspires you.
Bernard J. Tyson, rest in peace.
All right. Former CEO, Kaiser Permanente. Scripture quote you lean in on when things get tough.
I can do all things through God who strengthens me.
All right. That was the Michelle version. That's Philippians 4:13. I can do all things through Christ that strengthens me. All right. Favorite way to recharge?
The spa.
What's your favorite basketball team?
Oh, Detroit Pistons all day long. Hometown.
All right. What's your second favorite basketball team?
University of Michigan all day long.
What's your third favorite basketball
The
team?
LA Clippers.
All right. We can
Kaiser
live with that.
Permanente is the physician, the medical team that takes care of the Clippers. You want me to say the Golden State Warriors. That's okay. We take care of the Warriors too. We're the team doctor for the Warriors and the Clippers. It's all good.
Well, sin sometime is a multitude, but we forgive you.
Who's your favorite basketball team?
Golden State Warriors.
Oh, I said I can support them. It's all good.
All right. We ain't going to talk about basketball and love because this is not that subject. We're just simply talking about healthcare. We're grateful to have Michelle Gaskill Hames sharing her perspective on life, leveraging healthcare in the healthcare industry. This has been a great opportunity. I can't wait until you hear our next guest. Make sure you tune in, subscribe to Dr. Charley Hames on YouTube, Instagram, TikTok, and Facebook, and all other social media, including Blue Sky. I'm telling you, this is the podcast that's going to change your life. This is your host, Bishop Charley Hames Jr. This is the Leverage Factor. Peace.
Peace.